Today we're going to be talking about pain between your shoulder blades, that nagging, achy, sometimes sharp pain, sometimes that constant tightness that we have in this area here. First, let's talk about why we have pain in that area. So pain in the back of the shoulder blades often has to do with where we're sitting in the front. If you look around at most everyone nowadays, we tend to have our shoulders rounded forward, kind of pulled down. Why do we have that? We tend to be pec dominant. So pec major comes across from the sternum, from the clavicle. That's inserting into the humerus, your arm bone there. So that's pulling your humerus forward. Basically taking that humerus, pulling it forward. Pec minor is underneath that, kind of a stringier little muscle coming up from here at this diagonal, attaching right there to the front of the scapula. So that's pulling shoulder down a little bit. So pec major, pulling that humerus anterior, pec minor, pulling that shoulder blade down and forward. So a lot of pain between your shoulder blades in the back comes from front side and just being tight across the front of our body. We tend to be a very pec dominant culture. We sit kind of here, we're holding our phone here, everything's in front of us, and we use these muscles a lot more. We don't have our grandmothers, at least as often anymore, hitting us with rulers, telling us to stand up straight. Teachers aren't allowed to do that these days. So we just get very tight through that area. So pec major, it's coming across from the clavicle here, down the sternum. It's inserting into the humerus here. It's pulling your arm forward and pulling that humerus anterior in the joint. Pec minor is a stringier little muscle. Underneath that, coming up at this diagonal, it's attaching right here to the front of the shoulder blade. It's pulling your shoulder blade down and forward. So we go from, shoulders being back here. Now our humerus is anterior a little bit, and then pec minor's tight. It's giving that forward rounded appearance through our shoulders, through the front. In the back, what that means is our shoulder blades are not sitting beautifully quite here. They're getting pulled around like that because the pecs are so tight on the front. These muscles coming between the spine and the scapula right there, the rhomboids, they're just yanked on. They get tight, overstretched. Kind of like people, when they're constantly overstretched, they want to curl up in a ball. Muscles, when you chronically tension them, they'll put protective knots and kind of contract their tissue to relieve some of that constant stress on them. And that's how we get those nasty knots through this area, trigger points and buildup of acidic tissue. So let's talk about what we can do when we have pain through this area. So the first step is going to be actually to open up the front of the body, stretch out your pec major, pec minor, so that your shoulders can sit back, so your scapula can come right back here instead of sitting way out there. So I'm going to show you some foam rolling exercises for that. So this is one of my all-time favorite exercises to open up pec major, pec minor, and the fascia across the front of the chest so that your shoulder blades can sit back in their best functional position to take tension off of that area between the shoulder blades. So I'm on a long foam roller, just a nice smooth one here. And I'm just gonna lay back. Things to think about. Keep your knees out for balance. That'll keep you from tipping one way or the other. You're gonna take your low back and just press it down against the foam roller. That's gonna keep you from arching, which is a compensation mechanism. From here, take my hands. I'm gonna put the back of my hands on the ground, and I'm just slowly going to slide up, keeping the back of my hands, if I can. You might not be able to on your first try, keeping the back of your hands on the ground. And I'm going to feel that stretch across as I'm hitting all of those different angles of pec major, and as I pass 90 degrees and get up into this angle, I start to feel the stretch into pec minor. So today's a good day. I can keep my arms on the ground. Sometimes I'm a little bit tighter and I'm floating up here. So you can go all the way up. Typically, once you get way up here, you're stretching the lats more. Some people are tight in the lats, some aren't. Today I'm a little bit tight in the lats on the left side. You might not be able to see. So all the way up and slowly back down. So I don't know if I said this yet. We call these the snow angel. You might be able to figure out why. These are nice, slow stretches, just allowing the body to open up, to relax. And again, stretches, you should feel them. They should be, 2 out of 10 stretch. You don't want to really aggressively stretch through this area. If you feel an area where you're tight, you can just rest. Take some nice belly breaths in that area. You might start to get some tingling in your hands. The brachial plexus, all of the nerves, arteries, veins that run to your fingers, run right under pec minor here, and they can get compressed under there. If you're getting tingling, don't hang out there for 2 minutes. You can just slowly move through that area. Another reason that we're often tight through this area in our back is we spend a lot of time in forward flexion. So these muscles that run up and down our spine, they're called paraspinal muscles. They're also known as erector spinae. They're supposed to hold your spine erect. We tend to spend a lot of time here with that forward rounding through this area, just putting a lot more strain and a lot more weight on those spinal muscles. When we constantly stress these muscles, that area will tend to tighten up. We will lose our mobility through our thoracic spine. So looking at the spine, give you a close zoom up if I can. Thoracic spine is from here to here. If you look at those joints, they're all at this angle. The thoracic spine meant to flex, extend, twist one way, twist the other, bend this way, bend that way. We're supposed to be nice and mobile through this area. If we compare that to the lumbar spine, if you look right in here, those joints are set more straight forward and back. We're supposed to have some forward bending in our lumbar, but we don't get a lot of twist through our lumbar spine. What happens when we're locked up in this area through our thoracics and we can't do that twisting motion through our thoracic spine, more of that twisting motion goes into our lumbar spine. So for snow shoveling, we should be kind of bracing with our core, this area here, and moving with this area there. When we lose the movement in our thoracic spine, we're putting extra strain into our lumbar spine. That's how we get disc herniations, which happen way too often in the winter with shoveling. So now we're going to talk about foam rolling the thoracic spine. So we're going to start right here, base of the ribs, and just go up to the top of the shoulders. So I'm going to set this right at the base of my ribs. Lean back, lift my pelvis up so I can get my weight on there. I'm going to use my hands, kind of curl them around like this typically. That gets my shoulder blades out of the way. Also, if I have a ponytail, I want to hold that. Or a hoodie, you don't want that to get stuck underneath the foam roller. You can get stuck in some awkward positions. So, here we are. And we're just going to use our legs, contract our hamstrings to roll back and forth, get a nice massage of the paraspinal muscles, the lats, the traps. Get some blood flow going through that area. From here, I like to add a little bit of flexion and extension. So what we're doing, just starting right there at the base, moving a little bit, flexing up and down, just allowing those vertebrae to move on top of each other. Each segment should be moving separately. You might find areas, usually the broad line area up between the shoulder blades, where you're a little bit more stuck. This is a really nice exercise to do when you're warmed up after you've went for a run, after a hot shower. You might get some little pops as things self-release through there. And so you can work all the way up to the base of your neck. There. So just a really simple exercise for mobilizing your thoracic spine.